Normally, there are no well-defined spaces in the hand, but when there is collection of pus, these spaces will be seen, hence they are of clinical importance. The boundaries of these spaces are of importance because these boundaries will limit the spread of infection. And these spaces in the hand can be divided into those on the palmar aspect and those on the dorsal aspect of the hand. Coming to the spaces on the palmar aspect, there are what are known as mid-palmar, thenar, web and pulp spaces. Among these, now we will discuss about the pulp space. The objectives for the present topic is we should be able to define pulp space, its anatomy, that is its boundaries and contents, then its clinical importance. To understand the importance of pulp space, let us see a case scenario. A tailor comes to the OPD with a complaint of swollen and red terminal part of right index finger, which you are seeing in this case. Okay, so he has come with a complaint of swollen and red terminal part of right index finger with a throbbing pain. He gave a history of sewing needle injury about 6 days back. When you look at it, there is the distal part of thumb is red, swollen, and you can see the pus coming out. We can define pulp space as a closed subcutaneous facial space on the palmar aspect of terminal phalanx of each digit, and it is located between the skin and periosteum of terminal phalanx of each digit. In this picture, you can see one digit and you can see the arrangement of the phalanges, the proximal, middle and terminal phalanx you are seeing, and this is the dorsal aspect of the digit and this is the palmar aspect of the digit. And coming to the attachment of the tendons to the base of the terminal phalanx or the flexor digitorum superficialis and profundus tendons. So flexor digitorum superficialis to the middle phalanx and the flexor digitorum profundus to the base of the terminal phalanx on the palmar aspect. On the dorsal aspect, the extensor tendon attachment to the distal phalanx, that is to its base, can be seen. So coming to the palmar aspect of this phalanx is the pulp space between the skin and periosteum covering the terminal phalanx, periosteum of the terminal phalanx, and which is covered by the deep fascia. So this is a fat-filled space and it is divided into compartments by number of septa that are extending from the skin to the deep fascia, which is covering the terminal phalanx. What are the boundaries for the pulp space? So if you see proximally, there is attachment of the fibrous flexor sheaths. Then distally will be the tip of the digit. Anterior to this pulp space is the skin and subcutaneous tissue, which are forming the anterior boundary for the pulp space, and posteriorly will be the distal 2/3 of terminal phalanx, because the long flexor tendons will be attached to the proximal 1/3 of terminal phalanx, distal to which the deep fascia fuses with the periosteum of terminal phalanx. So that's how it is closing the pulp space. So it's a closed space between the skin and superficial fascia and the distal 2/3 of the terminal phalanx, which is covered with deep fascia. The contents of the pulp space are the subcutaneous fat, the sensory nerves, terminal branches of palmar digital artery that will be passing through the spaces, and it supplies the diaphysis of terminal phalanx. That's what you are seeing. So the branch from the terminal part of the palmar digital artery that is giving branches and supplying the distal part of the terminal phalanx. The proximal part of terminal phalanx is supplied by a branch from the digital artery proximal to pulp space. So that is, this artery to the base of the terminal phalanx is not passing through the pulp space. Make a note of it. Now let us recollect the case scenario where a tailor has come to the OPD with a history of pinprick injury to the right index finger and a complaint of redness, swelling and pain. Now, after learning about the pulp space anatomy, you should be in a position to answer the questions related to the clinical case. So what is the clinical condition? Mention about them in brief. Give anatomical explanation for the condition. Now let us see what is the clinical condition. So the case that was presented is this one. This is the picture of it, and it is a case of bacterial infection of terminal pulp space of the digit. This condition is known as phelon. Then you are seeing another picture where if the infection is of viral origin, it is most common being herpes simplex, then it is known as whitlow. So if the infection is because of bacteria, we call it as the phelon, and if it is of viral origin, we call it as the whitlow. So the pulp space infection can be phelon or whitlow. In the present case scenario, it is a bacterial infection known as phelon. Common cause for infection of pulp space is the pinpricks or cuts or accidental glass splinters piercing the pulp space. Infections of this space are more common, and if neglected, they can become serious. And the common fingers that are affected are the thumb and index finger, and bacteria enter this space through the sewing needle as in the present case, or through the pinprick injuries. The second question on clinical case scenario is the anatomical explanation for the condition. To answer this, you require anatomical knowledge of pulp space, and we have completed the detailed anatomy of the pulp space. Now you will be in a position to give anatomical explanation for the case. The fingertip pulp is divided into number of small compartments by the fibrous septum. So infection within each of these compartments can lead to formation of abscess, edema, that can lead to redness and swelling. You can see the cross section and longitudinal section of the pulp space. So with increasing tension produced by the pus, there will be severe throbbing pain in the finger. Because of compromised blood flow, there will be necrosis of distal 2/3 of terminal phalanx, because the diaphysis of terminal phalanx is supplied by branches of the digital artery that travel through the pulp space. The accumulated pus and increased tension in the spaces, they will occlude the arteries, thus resulting in avascular necrosis. Then why it is affecting only the terminal 2/3 of the distal phalanx and not the base or the proximal 1/3 of the terminal phalanx? The base or epiphysis of the terminal phalanx is spared because the arterial supply to this part is from a branch that arises proximal to the pulp space, and it need not pass through the fibrous septa. So that's how it is spared. So we can give explanation for the present condition which has result from pinprick in relation to the pulp space. So that has led to infection of the pulp space. With the result, there is collection of pus, and as the amount of pus that has accumulated is increasing, pressure is built up in the closed and compact spaces of the pulp that has resulted in redness, swelling and pain. So in this picture you can see the septa dividing the pulp space into various compartments. So, and the pus has accumulated in these compartments, and then there is compression of the branches of the terminal artery that are passing through the pulp space. So there is compromise in blood flow that has resulted in the avascular necrosis of distal part of terminal phalanx, which you can see in this picture. So this is the terminal artery that is supplying the distal 2/3 of the terminal phalanx, whereas the base of it is avoided because it is receiving the branch proximal to the pulp space. Because of this avascular necrosis, it can result in gangrene or, if left untreated, osteomyelitis. The infection can extend into the deep palmar space through the fibrous flexor sheaths. The treatment for pulp space infection in the initial stages is medical line of management. Then the next level of management is the incision and drainage, which is the best approach for most of the felons, and an incision will be given on the lateral aspect of the digit as shown in the picture, about 5 millimeters dorsal and distal to the distal interphalangeal flexion crease. Then the incision is continued to the edge of the fingertip, about 5 millimeters away from it, and then it has to be deepened and the pus will be drained. The incisions onto the fingertip are avoided to prevent damage to the tactile receptors present in this part. After learning about the anatomy of pulp space and its clinical importance, you will be in a position to answer the MCQ, that is, felon or Whitlow is infection of mid-palmar space, radial bursa, ulnar bursa and pulp space. So the right answer is the pulp space.